Hello and welcome. I'm Jon Garlick and I'm here with Sheriff Matthew Wade, and this is Calhoun County's Most Wanted. Sheriff, it's good to have you back.
Always good to be on the show, John. I tell you what, it's been a busy summer. I'm more of a fall guy anyway, so I'm looking forward to some football, some cooler weather.
Ooh, we don't want you to be a fall guy. Gotcha. Let's take a look at how busy we were last week.
5 arrests brings our count up to 5,086, all because somebody was willing to help us, and we appreciate that very much.
All citizens stepping up, and you guys putting people for a nice little rest in the hotel, Calhoun County.
Yeah.
But you're doing some renovations.
We are doing some renovations to the county jail. That's always a sensitive subject on people's mind, but we're doing about a $5 million upgrade to accommodate for mentally ill and suicidal inmates. It'll probably take about 18 months to 2 years to complete, but when it's done, the jail will be a safer and better place, not only for the officers, but for inmates. And and our goal is to take care of everybody like we're supposed to and to do the right thing.
Well, you always do the right thing, Sheriff, and we're very proud to have you as our sheriff.
Yes,
and proud to have you on the show. And now we're going to take a break. We'll have the first half of our lineup, and then we'll be back with a really cool guest here on Calhoun County's Most Wanted. And welcome to this week's edition of Calhoun County's Most Wanted. Our lineup this week brought to you by A1 Freedom Bail Bonding, located at 32 4 Mile Church Road in Anniston. Their phone number 256-236-7888. And first up in our lineup this week, Al Lee Reynolds. Mr. Reynolds, last known to be living in Anniston. He's wanted for bond revocation for possession of marijuana first, bribing a public servant, paraphernalia for selling and delivery, and failure to appear in possession of a controlled substance. Possession of marijuana first, trying to sell paraphernalia, bribing a public servant, and promoting prison contraband. And this is Steve Patterson. Mr. Patterson, last known to be living in Lincoln. He's wanted for probation violation for possession of a controlled substance. And meet Ricky Gilbert. Mr. Gilbert, last known to be living in Birmingham. He's wanted for failure to appear on possession of a controlled substance and use and possession of drug paraphernalia and theft of property force. And we'd like you to have a look at Miranda Trantham. Miss Trantham, last known to be living in Lincoln. She's wanted on a probation violation for chemical endangerment of a child. This is Shane Rojan. Mr. Rojan, last known to be living in Oxford. He's wanted on a bond revocation for domestic violence, strangulation / suffocation. And meet Brandon Howard. Mr. Howard, last known to be living in Anniston. He's wanted on a bond revocation for possession of a controlled substance and use and possession of drug paraphernalia. And this is Daniel Davis. Mr. Davis, last known to be living in Piedmont. He's wanted on a probation violation for failure to register under the Sex Offender Registration and Notification Act. And meet Albert Smith. Mr. Smith, last known to be living in Anniston. He's wanted on a failure to appear for possession of a controlled substance. And that's it for the first half of our lineup. Stay tuned for the second half later in the show. Welcome back. We hope you saw somebody in that half of the lineup. You might know where they are, and if you do, call Crime Stoppers or call the Sheriff's Office directly. You call, they haul. We are here with Ashley Hill, Admissions Coordinator.
Yes, sir.
For NHC Healthcare.
Yes.
Right? We're trying to get the sheriff admitted, but he won't admit to anything because
That's right.
he doesn't want to be a fall guy.
That's
Yeah.
right.
Well, Ashley, how are you?
I'm just great. Thank you so much for having me today.
Well, we're glad to have you here. Now, tell us a little bit about what goes on in NHC Healthcare.
Sure. So our center has the capabilities of admitting patients that are either from home, the hospital, even other skilled nursing facilities. And they come to us and they may need rehab, which we have many skilled services for. If they've fallen and broken a hip, for physical therapy, regain the strength for occupational therapy. Someone may have had a stroke and need speech therapy, and even sometimes respiratory therapy. So we have the means to, if they're not ready to go home after the hospital, for them to go ahead and come to our center to get the help that they need to get them ready to go back home, which we also transition into long-term care as well, where they're able to stay with us if they need a place to live and have that 24-hour care. And then also we have the service of memory care as well, which would also be long-term as well.
Okay.
But we also with the inpatient and outpatient services.
So NHC is a kind of a cluster of places, right?
That's correct, yes.
So what do you, when we see NHC out there driving around Golden Springs or Coleman, what is it we're seeing?
Yes, so when you're seeing our center, that is the healthcare center, and those are the services I had mentioned before. That's the rehab, the long-term, and then the memory care. We also have other centers that are assisted living centers. NHC has 75 rehabilitation centers within 11 different states, and
Wow.
25 assisted living centers, as well as mental health centers as well.
So how many states?
I believe it's 11 states. if I'm
11
not
states, really? Are they like in the
The
southeast?
southeast region,
Okay.
yes.
Wow, I didn't realize that NHC was.
We need NHC to come and bring us more mental health beds. That's needed. That's
Yeah, you need to kind of get out of the Jerry psych business and get into the
Maybe that's something
adult
we
psych
can work
business.
towards.
I'll help you do that. Sheriff will too.
Yes.
So it's always, our parents are getting older, and my parents had to go through that where we transitioned from their home to a continuing care facility and then ultimately into a health center, what we used to call
Right.
nursing homes. So tell us a little bit about that process and how you can help people do that.
Yes, so that is basically my role at the center. We receive referrals, and that would come from either a doctor's office, another assisted living, or hospital, or another skilled nursing center. We review the referral to be sure that we can care for the patient and that we can meet the patient's needs. For example, if they have a wound that they need to care for, we'll send and have it reviewed by our wound care nurse. Then we will work on getting the insurance verifications if needed, as well as getting the family in, call them, let them know that we would like for them to consider our center, call them in for a tour, and then we also will sit down and do the admission paperwork, so that when they are ready to be discharged, that everything is ready for them to roll into the center and for them to begin their stay in their therapy.
What are you seeing as the average age for people being admitted into your center?
That's really hard to say. It's honestly depending on their need. So, honestly, I can't pinpoint a certain age. It's just more so for, especially with the rehab section, like that's more so our revolving door, if you want to consider it that.
somebody with a stroke,
Right.
heart attack, or something that goes on, something after that.
So they're only going to be at our center for a short period of time, and there's no age limit on that. We have younger patients. The average age would be in our elderly age group, but there's not an age limit per se for
see.
patients that we can treat.
So thinking about, as we have our parents aging, or as I age,
I think you're your parents' age now.
I think I am my parents' age now. I'm what's left. So as we age, what can we do to help our families, our children, navigate this process? So what are some of
Absolutely.
the things that we should be thinking about?
And that's a really important question, because we have patients, families coming in to do the admission process, and this is the first time they're ever coming in contact with a center or having to go through the role of being in charge of their parents' care. So they're lost, and we're there to help guide them, and that's why we encourage them to come in for the tour so they can see the center, meet our partners, and have a better understanding of how the process works and what they need to do to plan for the future, for whether it's financial planning for long-term care or just to verify their insurance, just to make sure that they can be cared for that short rehab stay.
There was always talk about powers of attorney, medical powers
Yes.
of attorney,
I've
living
had-
wills, and all that
I've
stuff.
done all of that. I've had a living will done, and I think there's a lot of different things that go on when you say NHC, or people call them a nursing home. I think there's a lot of stigma to it, but I think there's a lot of positives that people could see that we could talk about after the break.
Yeah.
But,
Well, we are going to take a break. We'll take a break here, and we have the second half of the lineup, but come back for the second half of our guest segment here on Calhoun County's Most Wanted. And welcome to the second half of our lineup. First up this half, Shanta Johnson. Ms. Johnson, last known to be living in Piedmont. She's wanted on a probation violation for burglary third and possession of a controlled substance. And take a look at Dana Poole. Miss Poole, last known to be living in Ohatchee. She's wanted for a bond revocation on possession of a controlled substance, possession with intent to distribute, possession of marijuana second, and use and possession of drug paraphernalia. And this is Alexandria Surratt. Miss Surratt, last known to be living in Ohatchee. She's wanted on a probation revocation for possession of a controlled substance. We'd like you to meet DeAnthony Miller. Mr. Miller, last known to be living in East Aboga. He's wanted on a probation violation for possession of a controlled substance. And meet Daniel Marin. Mr. Marin, last known to be living in Oxford. He's wanted for failure to appear on criminal mischief first. And that's it for our Crime Stop for lineup this week. If you have any information on the whereabouts of these folks, please give Crime Stoppers a call. That number, 1-833-251-7867. Welcome back. We hope you saw somebody in that half of the lineup that you know where they are. And if you do, give Sheriff Matthew Wade a call. You call, he hauls. We're here with Ashley Hill, Admissions Coordinator for NHC Healthcare.
Yes.
Healthcare.
Place where
Is nursing home a bad stigma? Do you think that's a bad stigma?
No, because
Okay.
we can consider our long-term care is our standard
I think that's what-
traditional nursing home.
Yeah, that's what everybody's kind
Yes.
of called it. But you know, I think a lot of people are people are scared. They don't want to leave the comfort of their home, and that's I get it. Me either.
Yes.
But at the same time, you sit at home by yourself. You're alone all day. If your family comes home, a nursing home or a place like NHC has
24-hour care.
24-hour care,
Yes.
and they have programs and things you can do and be around other people. I think it can be better than what people think, but I get not wanting to leave the comfort of their own home. But we just arrested somebody that was for elder abuse that was taking care of their mother, and what they did was bad.
Yes.
But I don't think they started out to be bad.
Right.
And it gets away from them. They can't do it, and what transitions into a crime is because they haven't taken care of their loved one, and they're in bad shape, and they can't physically or medically take care of them, and it turns into a bad situation. A place like NHC can, it's professionals. They know how to take care of them.
That's right.
24-hour care. Also, there's programming for them to do things. They're not just sitting there, wasting away. I'm a firm believer that you got to keep moving. You got to keep doing. You need to learn things, keep your brain going, keep your body going. If you just sit down and do nothing, you start wasting away.
That's why we encourage the tours, really, so you can truly see and dive in and see activities going on, which leads us to that craft fair.
Oh, the craft fair, yeah.
Yes.
If I have to go in, I'm gonna be the bingo champion, and I'm gonna be I'm gonna visit everybody's room every day.
Better watch out. They take bingo very seriously. So we have, with the programs and activities and things, we had gathered several art projects from our patients and some of our partners. We're hosting a craft fair on August 19th, this Friday, 1 to 6 at our center. And art therapy has been proven to help Alzheimer's patients, and that is to be very therapeutic, to get their attention on just one thing. It's calming for them. They'll play soft music, and that we have gathered some beautiful artwork, and our partners have created some artwork themselves, and we have some outside vendors coming as well. So we're really excited about the event.
Yeah, art therapy is very good. Do you have mental health therapists up there, counselors and stuff to work
We
with
have
folks?
social workers, and like I had mentioned before, we have all of our therapy, respiratory, speech therapy, occupational, physical, and our
Mental
dietitian.
health.
Yes, and mental health, yes. That would more so be with our social work department, our social services, yes.
Okay. Well, geriatric mental health is a special field for therapy.
Yes, it is.
So, if people want to, get ready for that inevitable time, when the old folks, we downsize, we get to smaller house, and then eventually we go to assisted living, and then something happens and we have to go to some healthcare facility, and then it gets worse. So, if people wanted to contact you and come tour the facility,
Yes.
how would they do that?
They can either go on our website and get the phone number for the center is 256-831-5730, or you can email me directly, ashley.hill@nhccare.com. And our website has a lot of useful information as well. That is www.nhccare.com.
Okay. And when is this event? Friday?
The event is this Friday, 1 to 6 at our center. And if you want to be an outside vendor, there's still time to get registered and get your booth information to us.
Very good. I don't think I'll do that, but
No.
Sheriff might.
I can only draw stick figures.
Yeah,
You know, I'm
we'll
not a
accept
very good
anything
art.
you have.
I'm not a very good artiste, you know, but I can do little smiley faces is about as good as I can
We'll
do.
gladly take any donation. All proceeds are going to the Alzheimer's Association.
Well, so this would be a great time for people to come visit the center.
Absolutely.
You know, maybe years away, but
Yes.
you know, maybe your elderly parents are just starting to think about downsizing.
Absolutely.
This is an eventuality. This would be a great time to
We
tour the
have
place.
packets ready available.
And I will say this: Alzheimer's is a terrible disease, and hopefully they can find a cure to it. Just had a family friend's mother that I've known for a long time pass away from it, and it's just a horrible thing. And
It
God
is.
bless those that have to care for that for their loved one during that. So those people need lots of prayer and need lots of understanding.
Yes, sir.
I imagine there's a big demand for what you guys are doing
Absolutely.
here in the area. I know there's only a couple other places.
That's correct.
So
yes.
are you slammed? Are you full?
Our admissions office is quite busy, but yes,
Unfortunately.
if there's like like I said, we would prefer you come in, see the center, and really get an idea of what we're all about. And
It needs to
let
be a good fit.
the craft fair would be a wonderful time to come and check it out.
Yeah, go visit and contact people, get some packets, talk
Yes.
to people about how the money works.
Absolutely.
So tell us again when that fair is and how people can contact
August
you.
19th, 1 to 6, that's this Friday, 2300 Coleman Road at NHC Healthcare Center. And you can call the center 256-831-5730 or visit our website www.nhccare.com.
And your email?
Ashley, ASHLEY, .hill, HILL, at nhccare.com.
Well, very good, Ashley. Thank you for being
Thank you
here
so
and
much for
explaining that
having
to
me.
us. And we will be back in just a short time with our Crime Stoppers portion of the show and the crazy criminal. Stay with us on Calhoun County's Most Wanted. And welcome to the Crime Stoppers portion of our show, where we ask you to help us with these following cases. First up, between August 9th and August 10th, an orange steel backpack blower, steel train chainsaw, Milwaukee impact drill, driver, drill, skill saw, reciprocating saw, and an 8-foot extend light tower, Syntex chainsaw, and yellow Romex wire were all stolen from a home under construction in Old Downing Mill Road in Anniston. And between July 17th and July 23rd, a red Ibanez 4 string bass guitar, a purple Ibanez 4 string electric guitar, and a dark brown J. Tercer electric guitar were stolen out of a 2011 Nissan Sentra parked on Ridgedale Drive in Oxford. And that's it for the Crime Stoppers portion of our show. If you have any information on these cases, and we hope you do, give us a call at Crime Stoppers or the Sheriff's Office directly at 256-236-6600.
Stupid! You're so stupid!
And it's crazy criminal time.
You know, it never ceases to amaze me. Never ceases to amaze me. Christy Jones, 49, of Richfield, North Carolina. Apparently she was upset with her ex-lover or whatever it was, and so she was going to go burn his house down.
Oh, she
got
looks
serious,
like that.
got real serious. So she goes to burn his house down. She goes over there, sets fire to 2 different spots on the house. She cuts open the above-ground pool, and the homeowners come outside. She's actually holding one of their dogs. You know, understand I said homeowner because she didn't go to her boyfriend's house or a lover's house. She went to a stranger's house and did all this damage thinking it was his house. Surely she's been to the house before.
Don't call me Shirley.
Don't call me Shirley. But I'm just assuming this is stereotypical, and I know that I shouldn't do that, but looking at the mugshot, there might have been something else going on to play for her to mistake the house. Maybe this is a good time to tell everybody to don't do drugs.
Yes,
But,
it's an excellent time to tell
she
people.
got arrested for multiple counts of arson, criminal mischief, and the poor homeowner had nothing to do with the spat between her and her ex-lover or any drugs that she may or may not have taken. But, you know, if you're going to do something, you should at least make sure, if you're going to burn your lover's house down, that it's the right house.
Yeah, or not at all.
Or not
There'll
at
be a
all.
lawsuit on that somewhere. She'll end up paying for that.
I'm not sure.
That's a mess.
Yeah, that's a mess.
Yeah, yeah. So Additions to the jail, moving along forward.
Yeah,
Great,
we're moving
good
along.
stuff.
You know, great move that is going to be, like I said, it's going to make some cells that can be used to house suicidal inmates and mentally ill inmates, which right now we don't have that. So, you know, we're going from having nothing to being able to do a little better. You know, that's something that's growing and it's serious, and you know, our desire to do the right thing by everybody.
Well, so long as we have a limited number of mental health beds and we don't try to fix that problem, sheriff's offices across the nation will have to step up and become mental health facilities.
That's what we're doing, unfortunately.
Yeah, and we need to work on the other end of it. But if society fails to correct a problem, law enforcement is forced to deal with it. And we thank you for dealing with us this week, and we hope to see you again next week here on Calhoun County's Most Wanted.